This is the video presentation of positioning a patient for a neutral lateral cervical using the straight arm unit. Patient is in a gown and stocking feet. All artifacts are removed. Artifacts. Marker goes in the lower corner of our 10 by 12 cassette field on the bucky. Artifacts marker cassette. There is no cassette in this unit. It's actually hardwired in, so the intern would not need to put a cassette in. The intern would just say we'd be using a 10 by 12 cassette in vertical position inside the bucky. Artifacts marker cassette measure. We're going to measure him at midclavicular line using the calipers. And he is 27 centimeters, and we would take that measurement over and set that on the lateral cervical chart in the control room. Okay. Artifacts marker cassette measure set. Normal head carriage. I'm going to have the patient have a seat, so I'm going to hold the chair, and if you'll just gently have a seat in here, hips in the back of the seat, feet on the pegs, hands on your lap. Shoulder over the hip, sitting up good, straight and tall, looking straight ahead. And I would mark the patient for normal head carriage process, okay, and his transverse processes. And I would go through the normal head carriage process at this point, establishing how he holds his head and making that highest slash mark for his normal head carriage position. Okay, and lining those back up. Now, with a C-arm unit, once you finish establishing normal head carriage, you want to relax your patient and have him stand up, hold the chair as he stands out. Whenever you move an X-ray unit, that's a C-arm unit, you never want to move it with the patient seated in the chair, because for patient safety, you need to have them stand out. With a C-arm or a straight arm unit, like this is, when you move the tube, the bucky moves. When you move the bucky, the tube moves. It's kind of like a seesaw. So for the first image we're taking, which is neutral lateral, we have to neutralize this whole straight arm so that the tube and bucky are parallel to the floor. So I'm going to do that by using this button tube tilt, and I'm just going to raise this up until this little blue needle is on 90, and the needle here on the tube would be at 0, the needle here on the bucky would be at 90. So you have to listen for the unit to lock into a detent. It'll click right there. And so you can check, we're on 0 here, we're on 90 here, the whole tube arm is parallel to the floor, blue needle's on 90, we're just where we need to be. So, what we need to do is increase our focal film distance. So we have to move the bucky and tube away from each other. So what we're going to do in order to move that is to use this increase SID button right here. And what you'll see as I do that is this red strip here will line up, and it will actually pause on the 72 FFD mark when we reach it. Right there. Okay? It may be hard to see, but this little tab right inside here is that 72 FFD. So now we can have our patient sit back in, hold the chair again. Have a seat for me, please. Hips in the back of the seat, feet on the pegs, hands on the lap, sitting up tall, shoulder over the hip. I'm going to gently turn him in this position. And I'm going to move his chair to get his shoulder closer to the bucky. And then you feel yourself touch.
Touch me.
Okay, great. We're going to turn on the collimator light, shutters open. I'm going to use this up button to raise the whole tube arm system until my crosshairs superimpose on C1TP, just there. Okay, notice how the horizontal crosshair is on his C1TP, and it's striking the horizontal center pinstripe of the bucky. So this is not like the other rooms where your horizontal center can strike 1 inch above the center pinstripe. For a straight arm unit, your horizontal beam will superimpose for a neutral lateral right over the horizontal center pinstripe. So don't try to force it to go anywhere else. That's where it needs to be for this unit. All right. So I'm going to make sure he's snugged against the bucky. Are you touching tightly?
Yes.
Good. Close your eyes for me. Looking for any head rotation. If I see it, I'm going to correct it by turning the chair. If he had any head tilt, I would stabilize him and lean him at the waist. He doesn't have any tilt, so he looks good. Next, we're going to collimate using top and bottom shutters. So, bringing these shutters in, watching them both, and they are coming in to the bottom and the top of the 10 by 12 cassette field, just snugging against the anatomical marker. Now I'm coming in with the side or vertical shutters. Watching shutters on both sides, front and back, whichever one comes in first. Inside this 10 by 12 field, snugging up against the anatomical marker. Okay. And lean you back just a touch, stay on that vertical crosshair. Great. So next, we're going to use the 3 filter, and we're going to stick it onto the collimator housing using Velcro. And we're just going to place this 3 filter in this top quadrant that's closest to me, so it covers his orbit. Just like that. Okay, so check, make sure everything is good. We're going to tell the patient we're about to take your exposure. Please hold still. And we make the exposure. I would relax the patient. You go ahead and relax. I'm going to remove the filter. We're going to open collimation shutters. We're going to reposition anatomical marker for the next image. I'm going to hold the chair while he stands up. We're going to reset exposure factors for the next image, and we're going to return to step 6, reestablish thermal head carriage for the next image.